So finishing off with hypercalcemia, what you have here are the common causes are listed in table 13.9 on page 258. When you look at what you are going to recognize with recognizing cues, it really depends on how severe and how quickly the imbalance occurred. With cardiovascular changes are the most serious and life-threatening caused by hypercalcemia. With mild hypercalcemia, you'll see an increase in the heart rate and blood pressure. But if it is severe and prolonged, you're going to see a depression of the electrical conductivity of the heart, slowing the heart rate. Okay? So mild hypercalcemia, you're going to see an increase in your heart rate and blood pressure. But if it is severe or prolonged, you're going to see a depression of the electrical system of your heart, causing a lowering of the heart rate. You're going to see a decrease in your deep tendon reflexes, and you're going to see a decrease in your peristalsis. So what interventions are going to happen when you have a patient with hyperkalemia? What you're going to see is it's going to be essential that this patient is monitored on a cardiac monitor. You're also going to want to do fluid replacements that can restore normal calcium levels. You're going to see normal saline is usually given because sodium increases the kidney's excretion of calcium. If the patient is on thiazide diuretics, they will be discontinued and replaced with a diuretic that will enhance excretion of calcium, such as a loop diuretic or furosemide. You're going to need to continue to monitor this patient on a cardiac monitor because you're going to see, or you may see dysrhythmias and a decrease in the cardiac output. You're going to be looking for changes in the T wave and the QT interval, along with other rhythm and rate changes. For our intents purposes in this course, I just want you to know that there are EKG changes with hyperkalemia, and that if the patient is on a thiazide diuretic, it will be discontinued and replaced with a diuretic to help to excrete the calcium, such as furosemide. Okay? Now, so that's it for calcium. You're going to see, again, from health assessment, the Cheswick sign with patients. We also talked about Sforzoid sign with patients. Again, these are all reviews from your health assessment course. Phosphorus imbalances are not really covered as much because there's such an inverse relationship between phosphate and calcium. Our book at this time doesn't even cover it, so we're not going to be concerned with phosphorus imbalances at this time. We will look at them more closely when they appear with different disorders. Moving on to potassium imbalances, you're going to see both hypo and hyper magnesium levels with your patients. So when you're looking at magnesium imbalances, first we're going to look at hypomagnesium, meaning low magnesium levels. Again, the common causes of magnesium imbalances, both hypo and hyper, are listed for you in table 1310. When you have someone who is hypo or has a low magnesium, what you're going to be looking for is when someone has a hypomagnesium level, you're going to see an increase in membrane excitability. You're going to see cardiovascular changes. You're going to see an increased risk for hypertension, atherosclerosis. You may see some left ventricular issues. You're going to see premature contractions, atrial fibrillation. So you're going to see a lot of different cardiac issues when someone's magnesium is low. This is one reason, which we'll talk about more when we're in the cardiac chapter next week, why we monitor magnesium so closely with our cardiac patients, because it can cause, a low magnesium level can cause so many different changes within that cardiovascular system. When a patient's magnesium is high, they have a decrease in their central nervous system excitability or depressed nerve impulse transmission. Your patient may become drowsy or lethargic. With that, you're going to see a reduction or a decrease in their deep tendon reflexes. Although having a high magnesium level does not directly affect the lung status, because it does decrease muscle response, you can see respiratory failure related to weakened respiratory muscles. So what are interventions for a high magnesium level? It, of course, is reducing that serum level. You'll see that done with when kidney failure is not present. They'll give IV fluids. They'll give high ceiling amounts of loop diuretics, such as furosemide, to reduce the serum magnesium level. If cardiac problems are severe or their hypermagnesium levels are extremely high, they will give calcium gluconate to reverse the actions of the magnesium. So those are things that you will see when someone has a high mag level. Again, you will see when someone has a high magnesium level, they'll have a decreased respiratory status because of the weakened respiratory muscles. They'll have absence or decreased deep tendon reflexes. The medication is going to be IV fluids. If their symptoms are severe or their level is severe with their high magnesium level, they're going to give calcium gluconate to reverse the cardiac effects of the hypermag or the high magnesium levels. I'll repeat myself one more time. The main goal for this chapter, most of it should be a review. I want you to make sure that you're looking at the recognizing the cues as part of your assessment, and then what to do and what to take action, the interventions and taking action for the different electrolyte imbalances.